Hi guys, it's Doc Janelle. Welcome back to my channel. The subject at hand is CPH. And for this video, we will be talking about HIV and the other sexually transmitted infections. To be honest, you already have a good and solid background about HIV, especially after that extensive HIV awareness lecture series that we had. So for this discussion, I will be focusing on the things that were not covered during the webinar. And most importantly, I will also be sharing with you the other sexually transmitted infections which are important. So when we say sexually transmitted infections, they were previously called as STDs, no, or sexually transmitted diseases, but it was changed into STIs. So these are illnesses that are usually transmitted between humans by means of sexual behavior, such as oral sex, vaginal intercourse, and even anal sex. Moreover, these STIs can also be transmitted via the use of IV drugs, and even vertical transmission from an infected mother to her infant during childbirth or during breastfeeding. So what are the STIs that you know? Of course, we already have HIV. Actually, marami pa, no? You have your herpes, your gonorrhea, chlamydia, syphilis, and many others. So why is STI important? Because there is a growing public health importance due to its increasing morbidity and mortality all over the world. And ang mga STI kasi, they facilitate the transmission of HIV. So usually guys, when patients are suspected to have STIs, we include automatically HIV in the testing. So ako, I've encountered a lot of patients coming to the clinic complaining of STI symptoms. Lagi yan, nakapanel na siya. I include HIV, I include syphilis, I include even hepatitis B, no, doon sa mga pinapatest ko para malaman ko lang, kasi usually STIs, they come in bundle, no? And it also causes a lot of complications such as infertility, ectopic pregnancy. Sabi ng ectopic pregnancy, you became pregnant pero hindi sa uterus nag-develop si baby. It developed in another place, no? Kaya siya ectopic. It also causes low birth weight and even prematurity. So there is really a public health concern when it comes to STIs. We have been battling STIs for a long time now. But why is there a failure to control these STIs? Number one reason is there is a low priority given by policymakers and planners to this public health concern. Konti yung resources na binibigay in order to control STIs. Secondly, kung meron mang budget, kung meron mang attention, kung meron mang policy making, it is concentrated on dealing with the symptomatic patients. Nakafocus masyado on those with obvious signs and symptoms. And usually these are men. And we fail to identify asymptomatic individuals, which are commonly women, not until the life-threatening complications develop. Number three, the service delivery has often been through specialized STD treatment facilities only. So, maraming natatakot magpa-test kasi when they go to these clinics, when they go to these treatment facilities, people already know, no? People around the community will already know kung bakit ka nandoon, and it causes stigma to these people. Number four, the ineffective low-cost antibiotics, self-medication, or referral system, no? Ito inumin mo kasi nainom ko dati effective. These are the reasons for antibiotic resistance. And fifth, there is still little emphasis on the importance of health education and other efforts to prevent infection. So, even in our law, even in our promulgation, yes, meron tayong RH law. But the RH law was not formulated to decrease the number of STIs. Rather, it was created to decrease the number of population. So hindi pa rin niya na cover, no, a lot of the problems brought about by these STIs. So let's talk about the first and the most important STI, which is HIV/AIDS. AIDS was first described in 1981, and sadly it was called gay cancer or GRID, or gay-related immune disease. It started when a number of cases of pneumonia was discovered, and ang causative agent ng pneumonia na nakita nila was Pneumocystis carinii. Previously, it was Pneumocystis carinii, but now it has been renamed to Pneumocystis hirovecii. You will encounter this during your third year in your microbiology. So, Pneumocystis carinii or Pneumocystis hirovecii is an opportunistic bacteria. Okay, it is an opportunistic microorganism, meaning lumalabas lang yan kapag mahinang-mahina na ang immune system. And they found that these patients with Pneumocystis hirovecii pneumonia are homosexual men, no, clustered around Los Angeles. Second suspicion was when there was a large cluster case of Kaposi sarcoma. Kaposi sarcoma is the image that you see on the lower right. Para siyang mga rashes, no, on the skin. And again, they found that it was common in young homosexual men. And Kaposi sarcoma, like your Pneumocystis hirovecii, is an opportunistic infection. So when they discovered na may kumakalat na sakit among homosexual men, and this illness causes the immune system to go down and result into opportunistic infections, they immediately called it the gay cancer. Eventually, in 1983, the virus which caused this disease was isolated, and it was called HIV-1. In 1986, a second strain of the virus was isolated, and it was called HIV-2. Now, this is the exciting part, no? Scientists later found out that this disease already existed many years prior to the 1981 cluster cases. They found that a blood sample from a Bantu man who died of an unidentified illness in Congo in 1959, tagal no, 1959 pa namatay, pero na-save nila yung blood niya. He had a similar finding to this young homosexual men in 1980. And this confirmed that even in 1959, there were already cases of HIV. So, the question in the minds of the scientists were, where did HIV come from? So, their research brought about the result that HIV-1 and HIV-2 actually originated in Africa. And just like many other diseases, and just like how we think COVID-19 started, the virus jumped from one species to another. So in this case, it came from chimpanzees for HIV-1 and sooty mangabees for HIV-2. The question is, how do you think did it jump to humans? If it came from apes, how did it get to humans? We can only speculate. So AIDS awareness was soon brought to the public's consciousness when somebody with AIDS publicly announced na meron siyang AIDS. And this was the popular film star Rock Hudson. You can actually search him on the internet. He died of AIDS in October 2, 1985, shortly after making public his AIDS status on July 25, 1985. He became the first major public figure to announce that he has AIDS and actually die from the disease. So, HIV, or the human immunodeficiency virus, is actually a member of the Retroviridae family. To be specific, HIV is a member of the lentivirus subfamily. So hopefully we got that, no? It belongs to the bigger family of Retroviridae and then the subfamily of lentivirus. So it belongs to a group of viruses called retrovirus because they have a special ability. They can insert their RNA to the host cell via a an enzyme called reverse transcriptase, or a process called reverse transcription. Later on, I will discuss what that meant. Okay? And there are two types as isolated, no? HIV-1 and HIV-2. In general, the picture of HIV-1 is it is aggressive, highly contagious, and highly aggressive. While HIV-2 is less pathogenic and hindi siya spread all over the world. It's confined mainly to the West Africa. So here is a table differentiating the two strains of HIV. And as mentioned, HIV-1 is the more infective one. It is the more virulent one, meaning more aggressive. And even yung time that it takes to develop AIDS, no? For HIV-1, less than 10 years, you can develop AIDS. But for HIV-2, it will take more than 20 years. So HIV-1 is the strain that seems to be more problematic. Now, in terms of the HIV structure, again, it is an enveloped RNA virus. You have to remember that it contains RNA. And as with the other viruses we've mentioned, it has a glycoprotein spike. And there are two important glycoprotein spikes, GP120 and GP41. Glycoprotein 120 forms the outer membrane subunit. In fact, in this image, it is the purple rosette that you see here. No? Siya yung parang purple na nakapaligid, the outer membrane subunit. GP120 is important because it is the one that binds to the CD4 receptor. What is CD4? Later on, we'll go to that. So it is the one that binds to the CD4 receptor. On the other hand, we have glycoprotein 41 or GP41, and it is also a transmembrane protein. Transmembrane meaning it is a protein that penetrates the cell membrane of the virus. So if GP120 is for attachment, GP41 is for fusion. Okay, it is for fusion. So now that we know the HIV structure, we can now go on and discuss the life cycle of the virus. Once HIV enters the body, it will start to look for its target cells. And the target cells are your CD4 cells, as you can see here. Your CD4 cells. It will begin with binding, followed by fusion, the all-important reverse transcription, integration, replication, assembly, and then budding. So let's discuss this one by one. Binding is also known as attachment. Okay? So in this part of the process, your glycoprotein 120, which is the outer membrane, right? Outer membrane protein, will attach itself to the receptors found in your target cell, which is CD4. So the attachment is called binding, as you can see in the GIF. The second step is fusion, and this is where your GP41 will take action. So in fusion, the HIV and the CD4 cell membrane will fuse together. So it will remove the envelope, allowing the viral the viral RNA genome to enter the host cell. After the RNA has entered the cell of the CD4, HIV will release the enzyme reverse transcriptase. What this enzyme will do, it will convert HIV RNA to HIV DNA. Now, this is quite special because usually it's the other way around. DNA will create RNA. not the other way around. Okay, again, normally, DNA will create your RNA. But in this case, DNA was created from your RNA. So it is a reverse process. Okay, it's a reverse process. So in reverse transcription, it allows the HIV to enter the CD4 cell nucleus. Okay, it allows the HIV virus to enter the nucleus and combine with the CD4's genetic material. So this shall lead us to step number 4, which is integration. So nakagawa na ng ng HIV DNA out of the RNA. So kahit may HIV DNA, kung hindi naman yan may incorporate sa CD4 DNA, walang sense. So, yun yung importance ng step 4. HIV will release integrase. This is an enzyme that will allow the integration of the viral DNA to the CD4 DNA. So magsasama yung DNA ng virus at yung DNA ng CD4. Once magsama na yun, it can lead to replication. So the newly formed DNA, the newly fused DNA of CD4 and HIV will create the long chains of HIV proteins. No? So makakagawa na siya ng HIV proteins kasi in-infect na niya yung DNA ni CD4. So that is replication, the creation of proteins. Afterwards, it will be followed by assembly, where the new HIV proteins and the new HIV RNA will again assemble to become an immature HIV. Afterwards, this immature HIV will push itself outside of the CD4 cells, as you can see here in the GIF, no? And it will be protease that will break the long protein chain that form the immature virus. Okay? So the smaller proteins will combine to form the mature HIV. All right? So why does HIV target CD4? What is with CD4 that it has become the sole target of your HIV virus? CD4 is actually a lymphocyte. To be specific, it is a T lymphocyte. So CD4 lymphocytes are central regulatory effector cells of the immune system. They are the ones that give a signal to the rest of the immune system when an intruder enters. So it is the one that alerts everybody. No? It alerts everybody. So it is also essential so that your other phagocytes can kill these intruders. So without CD4 telling the phagocytes that there is an intruder, the body won't be able to kill foreign substances. And if the body can kill foreign substances, the immune system will crash, allowing opportunistic infections to ensue. And this can actually be fatal. So now that we know how HIV replicates in the body, who is the target, how do we get HIV? So HIV is transmitted only in 3 ways. Sexual contact. So this can be oral or genital, even anal, no? Second is perinatal transmission, mother to child, especially during the last weeks of pregnancy. And the sharing of blood and blood products. So this already includes your sharing of needles, transfusion of infected blood, and even organs. Diyan siya papasok sa blood and blood products. So in the Philippines, the highest contributor to HIV is male-to-male sex. That's why the population mostly affected are men having sex with men. This is followed by sex with both males and females. And then male to female sex. And then fourth is mother to child. But still, the main transmission route is through sexual intercourse. Once HIV enters the body, it will produce 3 specific stages: the acute HIV infection, the clinical latency, and if not checked, it will produce your AIDS or the acute immunodeficiency syndrome. Acute HIV infection is a short-term infection characterized by non-specific symptoms. Parang flu lang siya. Okay? So usually when you develop the acute HIV infection, you won't really take it seriously because again, the symptoms are non-specific. And then you enter the clinical latency phase, also known as asymptomatic HIV or chronic infection. At this point, HIV is very much active. Nagre-reproduce yan in your CD4. But during clinical latency, very low levels pa rin. That's why they are undetectable. Later on, the viral load will continue to go up and your CD4 count will continue to go down, allowing immune system to crash. And when the immune system has been badly damaged, you will now enter your AIDS or acute immunodeficiency syndrome. It is the most severe stage, the end stage of HIV infection. And during this point, people will start to have opportunistic illnesses. So let's look at this diagram here showing us the changes in terms of CD4 count, immunity, and even the amount of virus in our blood. So during the first few months, CD4 remains to be stable. Initially, bababa during the acute HIV stage, but it will be able to recover. Even the immune system, the immune system will be able to recover in the first few months. However, once you exceed a few years, as studies would say 2 to 10 years, the virus will continue to go up. The amount of virus will go up while the amount of CD4 will go down. As CD4 goes down, your immunity will also go down. And it will be downhill from there. So how do we diagnose HIV? Actually, there are many ways. Currently, a lot of people would rely on antigen and antibody immunoassays. People can get this for free from many health clinics and facilities. But if we want to confirm the diagnosis of HIV, we perform a Western blot protein test, or simply the Western blot. Now, there are developments being made so that a nucleic acid test can also be done. And the promise of the NAT or nucleic acid test is that there is no need to wait after the window phase. The window phase, by the way, is 3 to 6 months. And at this point, HIV becomes undetectable. So here is an image showing us the antigen and antibody test via ELISA. So you collect blood from a patient and then you expose that blood to the HIV, IgG, and IgM. And if there will be an agglutination, it means that the body has the antigen. Pwede rin kabaliktaran, no? You will put an antigen in the blood to check if may antibody bang present. Okay? So that's how you test for antigen antibody. Try to determine if the patient already has developed antibodies against the antigen or the other way around. The confirmatory test is called Western blot. And in a Western blot, you try to determine if the patient's specimen has the glycoproteins specific for HIV. Okay? So, you will put it in a band, tapos titignan mo ron kung magla-light up or kung magmamarka yung mga glycoproteins. So, in a positive result, you should be able to find your GP120, GP41, and even your GP24. Okay? So, yun lang yung ginagawa ng Western blot. So, how do we manage HIV? As mentioned in our lecture series, there are many antiretroviral agents. But the job of this antiretroviral agent is not to completely kill off the virus. Rather, it just prolongs the latency period, or the period where you don't have symptoms. And HIV becomes undetectable at this point. So there are several types of antiretroviral agents. You don't have to memorize this naman. Okay? So now we will proceed to the other sexually transmitted infections. And the first one I have here is syphilis. Syphilis is actually caused by a bacteria. So if HIV is a virus, syphilis is a bacteria. And the name of the bacteria is Treponema pallidum. Treponema pallidum. Treponema pallidum is a bacteria that is classified as a spirochete. Spirochetes are a group of spiral motile bacteria which are transmitted via direct contact with a syphilis sore. So, kita nyo yung image dito ng tongue. Those are syphilis sores. And if you touch that, no, if there is direct contact, whether through kissing or through any sexual activity, you can get infected with this. Moreover, mother-to-baby transmission is also possible. Okay? So here's also another image found on the penile head. You can see those syphilis sore, no? So syphilis, if you get it, has several stages. The first is primary syphilis. So sa primary syphilis, there is only local multiplication of bacteria and usually at the site of entry. So commonly yan sa genitals during genital sex or even in the tongue during oral sex. Okay? So this bacteria can actually spread to the lymph nodes and even to the bloodstream. And usually, the findings is the appearance of hard chancre. Hard chancre is an ulcer that you can see right here on your slide. May ulcer dun sa penile skin, may ulcer din dun sa dila. So hard chancres are actually ulcers, but they are painless and usually solitary. They are characterized by a raised and well-defined border. Kita nyo naman, no? Very well-defined yung border. Kitang-kita mo kung saan nag-end yung ulcer. So usually, the primary syphilis or the hard chancre would appear 10 to 90 days after infection. And it would heal spontaneously. That is why people would miss out the chance to actually get treated kasi nawawala siya spontaneously. If not treated, then it will proceed to secondary syphilis. Secondary syphilis is more of a skin manifestation. So you will develop a red maculopapular rash anywhere in the body but most commonly in the hands and on the feet. So, usually they appear moist, pale papules. Pag sinabi nating papules, these are raised rashes, commonly also in the anogenital area, sa kilikili, and even in the mouth. Okay? When we say anogenital, anus and genitals. Your secondary syphilis, if not treated, will lead to systemic dissemination of the organism. So Treponema pallidum will continue to circulate in our blood. And usually, the systemic dissemination will occur 1 to 2 months after mawala yung primary chancre. Diba? Sabi ko kanina, the primary chancre will heal on its own. After 1 to 2 months, doon nalalabas yung secondary syphilis mo. So aside from the skin manifestations, you can also expect enlargement of the lymph nodes, fever, sore throat, neurologic signs. But then again, you can expect spontaneous healing. That's why people would miss out the diagnosis. But they cannot miss out the development of latent syphilis. Itong latent syphilis, wala nang signs or symptoms. No? Parang magically gumaling ka. Ganun yung appearance niya. So the patient is non-infectious except for maternal transmission. So, latent syphilis would occur less than a year after primary stage kung nasa early latent stage ka, or more than a year after primary stage kung nasa late latent stage ka. So, the person may still be infectious. And the problem is not everyone, not all patients ng syphilis will enter this phase ng latency. Some will directly go from secondary to tertiary. Ano ba meron sa tertiary? Tertiary syphilis occurs months, even years after the secondary infection. And there are 3 important manifestations. Number 1, the development of your guma. Kaya siya tinawag na gumatous syphilis. Kasi the manifestation of this type of or stage of syphilis is the development of your guma. So this guma are actually granulomatous lesions, found in your bones, skins, and subcutaneous tissue. Other manifestations include cerebrovascular disease. So not cardiovascular diseases. Why? Because nasisira ang aorta. So, pag nasira ang aorta, it will lead to problems in the heart. And lastly, pwedeng mag-develop ng neurosyphilis. What is neurosyphilis? Yung pag-travel ng syphilis bacteria towards the central nervous system. It will lead to memory loss, muscle weakness, dementia, seizure, and even paralysis. So, as mentioned, it is also possible to have vertical transmission, and we call this congenital syphilis. Congenital syphilis development is common when the mother gets infected during the early to early latent syphilis. Commonly, the babies get infected during the 2nd or 3rd trimester. And these babies who will develop congenital syphilis might not even be born due to sepsis caused by necrotizing phoenicytis. What is necrotizing phoenicytis? Inflammation of the umbilical cord. So imagine, namamatay sila due to inflammation of their umbilical cord. And if they get born, there is a syndrome that develops. Meron silang interstitial keratitis or namumuti yung mata. May Hutchinson's teeth or parang nagiging very sharp yung kanilang mga ngipin. Pwede ring 8th nerve deafness. Okay? The problem with cranial nerve number 8. Or pwede ring periostitis or infection in the gums. So how do we diagnose syphilis? So the specimen of choice is tissue fluid or serum. And then what we do is we look at the specimen under dark field microscope. So as you can see here, the spiral-shaped Treponema pallidum has been detected. Pwede rin mag-undergo ng immunofluorescence. Ito, or even serological testing. Yan siya. So there are actually 2 types of serologic testing. These are non-treponemal and treponemal. So, ang non-treponemal screening test lang siya. Why? Because ang hinahanap mo is not really an antigen or antibody of syphilis. What you are trying to detect are antibodies against a specific part, or kamuka ni Treponema pallidum. So, we use usually reagin. Okay? Kaya meron tayong VDRL and RPR. You will encounter this during your 3rd year in Immunosero. RPR and VDRL. Again, they are screening tests only. So, ang reagin kasi, it is an antibody against the substances released by Treponema pallidum. So, ang Treponema pallidum, nagre-release sila ng cardiolipin. And cardiolipin, merong antibody against cardiolipin, and that is reagin. So, hindi directly yung Treponema pallidum yung dinidetect natin. Rather, yung cardiolipin through its reaction with the antibody reagin. Okay? If we want to confirm syphilis, it will have to undergo a treponemal test. So in a treponemal test, you now try to detect the antibodies against Treponema pallidum. Specific na ngayon, no? Antibodies against Treponema pallidum. And there are several types of tests that you have here. TPPA, TPHA, common yan, TPHA, and even FTA-ABS, or fluorescence treponemal antibody absorption. So what do you use to detect kung meron kang syphilis? Blood. Yun pa rin ang most convenient na sample. So how do we manage it? Just by controlling, no? Control natin yung sexual intercourse. Kailangan lahat ng cases natin nagpa-follow up, ma-advisean sila on protected sexual intercourse. But if you want to talk about medical treatment, the drug of choice for syphilis is penicillin. Lastly, we have gonorrhea. Gonorrhea is caused by a bacteria. So kanina, dalawang virus pinag-usapan natin, HIV virus and, syphilis is a bacteria also pala. So gonorrhea is also a bacteria caused by Neisseria gonorrhea. It is a gram-negative cocci. Kung ano yung ibig sabihin nun, it will be discussed in your third year microbiology. Cocci, ibig sabihin, they appear circular. So gram-negative cocci, and usually they appear in pairs. I'm not sure if you can see here in this image, but they usually appear in partners. They pair. And usually they are intracellular. Kita nyo naman sa image sa baba, no? Itong mga Neisseria gonorrhea that comes in pairs, they are inside. What do we have here? This could be a neutrophil, no? They are inside the neutrophil. So gonorrhea causes infection in the genitals, in the rectum, and even in the throat. Common yan in teenagers and even young adults who become very experimental in terms of their sexual experiences. It is transmitted through sexual intercourse and even mother to baby. So once the gonococci or the Neisseria gonorrhea enters the body, it can enter through attacking the mucous membrane ng genitourinary tract, pwedeng sa mata, sa rectum, and even sa throat, no? So in Tagalog, gonorrhea is also called tulo. Tulo ang tawag dyan. So, ang nangyayari, you develop nana, you develop pus in your genitalia. As you can see in the image, no? Yung penis, parang may nana na lumalabas, even yung cervix dito, no? May nana na tumutulo. And then the blue thing that you see here, those are the paired Neisseria gonorrhea. As mentioned, they come in pairs, kaya ganyan yung itsura nila, laging dalawa. So for males, it causes urethritis. What is urethritis? Inflammation of the urethra. What is the urethra ba? This is the passageway of urine. Okay, urethra is the passageway of urine. So, there can be urethritis and accompanied by the yellow creamy pus, yung nana, and painful urination. For most of my male patients, they complain of painful urination, tsaka yun nga, para daw may nana na lumalabas. For females, the primary infection is endocervix. So as you can see here, itong parang donut appearance dito, this is your endocervix. Okay? If not treated, this infection can go to your fallopian tubes or uterine tubes and cause salpingitis. Salpingitis is the inflammation of your uterine tubes or fallopian tubes. So that's what happens. It will also develop some other symptoms such as sore throat, kung sa throat napunta yung bacteria. Pwede rin sa rectum if anal sex ang nangyari. No? Itching, soreness, bleeding, painful bowel movements. For females, vaginal bleeding, painful urination, and vaginal discharge. And for males, almost the same, no? Painful urination, discharge from the penis. So how do we diagnose gonorrhea? So una, you have to determine what specimen to use. And you can actually use the pus or yung nana coming from the genitalia no? Pwede rin yung nana and secretions coming from your eyes and even the throat and synovial fluid. So once you have the specimen, you actually subject it to gram stain. So, stain mo na para malaman mo kung meron ba siyang paired diplococci sa kanyang mga cells. Aside from staining, you can also do blood culture. And the blood culture that is commonly used for gonorrhea is modified Thayer-Martin. Please do not forget that. Modified Thayer-Martin. You can also do the other usual tests such as serological testing, immunoblot, radioimmunoassay, and ELISA. Lastly, how do we manage gonorrhea? So, with antibiotics, since this is a bacterial infection. So, you have your penicillin, tetracycline, spectinomycin, quinolone, cephalosporin. But the last recommended dual treatment is ceftriaxone plus azithromycin. And ako personally, I give my patients ceftriaxone and azithromycin. So that's the end of the discussion. For your major exams, for your finals, this will not be the only source of HIV questions. We'll also include those that will be coming from the webinar. So thank you guys and God bless.